we can do something to try to prevent it or to slow the progression of the disease.
February is Age-Related Macular Degeneration Awareness Month. While AMD might be unfamiliar to some, nearly 500,000 of people in Quebec are affected by this disease, which is the leading cause of blindness for those aged 50 and older.
What happened with the macular degeneration is that you have small deposit underneath the retina that can accumulate with time, and sometimes also abnormal blood vessels can grow underneath the retina and cause decreased vision or distortion in your vision. Like if you look at straight lines, the line can be bent or wavy.
Sylvie Castonguay was first diagnosed with a dry form of AMD in her left eye at the age of 64. 3 years later, she received a second diagnosis for her right eye.
It's blurry, like the vision is a bit different, and I have some gray spots in the central vision.
The problem is that when the disease is early, there's no symptoms, so people can have normal vision. The only way to detect macular degeneration at that time is to have eye exam with your optometrist or with an ophthalmologist.
Dry type of AMD is more common, but it usually progresses slowly over years. The wet type is more likely to cause a relatively sudden change in vision, resulting in serious vision loss.
For the dry type of macular degeneration, the treatment is vitamins and supplements that people take every day. It decreases the risk of progression to a more advanced form of macular degeneration by 25%. People with more advanced disease, the wet form, it's when abnormal blood vessels grow underneath the retina, can be treated with injection in the eye.
The Association québécoise de la dégénérescence maculaire warns that some are at a higher risk, including those with a family history of AMD, smokers or ex-smokers, and those who spend extended time in the sun without proper eye protection. The association encourages anyone experiencing unusual visual symptoms to seek out screening. It also offers help for those living with the disease.
They're caregivers because after a few years, if your vision loss is important, you need someone to support you.
In Montreal, Johanie Bouffard, City News.